Hello, my geniuses. Welcome to another anatomy lecture series today. It's your great scientist Lorenzo, and today we'll be talking about the muscles around the shoulder region. In my last video, we talked about the muscles around the pectoral region. So today we specifically talk about the muscles of the shoulder region. We have divided them into intrinsic and extrinsic, and I'll talk about all the movements, the rotator cuff muscles, everything. So I'll be taking it step by step. So make sure to follow the video to the last. And if you have a question, also drop it down in the comment section. And if you are new to my channel, make sure to subscribe and turn on your post notification button so that anytime I drop any video, you'll be sure to be notified. And if the video is fast, make sure to just you can slow it down or use this YouTube subtitle, and it will be much more easier for you to understand. And always use your atlas, like I always say. Let us jump right into the video. So welcome to another video. Today we're talking about the muscles around the shoulder region. In my last video we talked the muscles around the pectoral region, which is located on the anterior thoracic wall, and their function is to move the arm at the shoulder. They also help to stabilize the scapula, and the last one is that they assist in respiration. But in this one we're talking about muscles around the shoulder region. Now, in the muscles around the shoulder region, one thing, they also connect the trunk to the upper limb, same as the pectoral region. And now they provide stability to the shoulder joint, which we call the glenohumeral joint. One is they connect the trunk to the upper limb, just like the pectoral region. Two, they provide stability of the shoulder joint, or we call it the glenohumeral joint. And one important thing, they provide a wide range of motion, which means they do all the whole motion, which is flexion, extension, abduction, adduction, rotation, and circumduction. Unlike the muscles of the pectoral region that does flexion, adduction, medial rotation, protraction. You get it now. So they have a limited range of motion. You get it now. But for this one, it's all work on the shoulder joint by doing everything for the shoulder joint. So they provide a wide range of motion. But one thing is that on the shoulder joint, they are very, very unstable. Are you getting that? Because the shoulder joint is the most movable type of joint. That is the shoulder joint. We'll be talking about it in my subsequent video. The shoulder joint is the very and most important mobile joint in the body. So it's the only mobile joint very well that moves in all range of motion. Also the hip joint, but the only thing that the shoulder joint moves very well more than the hip joint. Even though both of them are ball and socket joints, it's just that the shoulder joint moves more, which that is why we call it the most mobile joint. Also, it's also the most unstable joint, if you want to know. So now, importantly, now since we have there are also some clinical scenarios to be bringing out from this. So keep watching us and keep listening to the video. So we'll be classifying the muscles of the shoulder region, or the muscles around the shoulder region. The muscles around the shoulder region is divided into extrinsic and intrinsic. Don't forget, extrinsic and intrinsic, or we can call it superficial and deep. Now, muscles around the superficial region or the extrinsic region are the muscles that you can see very well. So when you strip the skin and the superficial fascia and the deep fascia, the muscles you can see, you'll be seeing the trapezius muscle upper, you'll be seeing latissimus dorsi lower, you'll be seeing the rhomboid muscle, and you'll be seeing the levator scapulae. While in the muscles in the intrinsic compartment, which one will you see? The deep muscles. Now the deep muscles are the deltoid, supraspinatus, infraspinatus, teres minor, teres major, and subscapularis. Don't forget. Now these are the muscles of the extrinsic and the intrinsic. Now in the muscles, we'll be starting first with the intrinsic muscle. So I want to start from inside to outside, from inside to outside. So we are talking about the intrinsic or deep muscles in this video, while in my next video we'll talk about the extrinsic muscle. So now in the intrinsic muscle, don't forget this mnemonic: sits down there, sits down there. That is SITS, sits down there. Now when you remember sits down there, we should know that sits in this mnemonic, we call it the rotator cuff muscles. They are called the rotator cuff muscles. So, and I might bring a separate video for them, or I'll just explain it inside this once and for all. But the sits under this one is the rotator cuff muscle, while down there is the remaining. So what is sits? The first one is supraspinatus, I infraspinatus, T teres minor, S subscapularis. Don't forget, sits down is deltoid. The last one is T major, or you call it teres major. So maybe in my another video I'll dedicate a video solely for rotator cuff muscles, but in this video we just want to explore them one after the other, so you know their origin, insertion, action, the way I did the muscles of the pectoral region. So always stay with me, always stay with me, because you'll be learning a lot and you'll be very, very good. You will sabi something very well, your brain will be hot. So that's why I want you to always watch my video. So now the first one I'll be talking about here is the word supraspinatus. So because we are using the mnemonic sits down there. So what is the supraspinatus? Where is the origin of the supraspinatus muscle? Because it's part of the rotator cuff muscle. So the supraspinatus muscle now is coming from the supraspinous fossa. It's coming from the supraspinous fossa. Remember in my scapular video, you remember that the scapula has an anterior, which you call the costa, and the posterior, which is at the back. So how do you differentiate the anterior from the posterior? The posterior has a spine, which you call the spinous process. So the posterior has a spinous process, while the anterior has a depression. The depression is called the subscapular fossa. The subscapular fossa, which is the anterior, while the posterior has a spinous process. And that spinous process is divided into supra and infra. The supraspinous on top, the infraspinous below. So go and watch my video on the scapular bone, and once you watch it, it will be much more easier to understand what I'm saying now. So it's coming from the supraspinous fossa, where is supraspinous fossa? Above the spine, and it's inserting on the what? The greater tubercle. It's inserting on the greater tubercle. Which part of the greater tubercle? The superior facet of the greater tubercle. Very, very easy. The superior facet of the greater tubercle. So since we know it now, what is the nerve? The nerve supplied to these people is suprascapular nerve. Suprascapular nerve, which is derived from the upper trunk, C5-C6. Don't forget. C5-C6. And what is its action? What is the work of the supraspinatus? It raises our hand in abduction between 0 to 15 degrees. So we call it, it helps in 15-degree abduction. 15-degree adduction. So when you take your hand out of your body, maybe you are carrying your bag or something, so you are doing 15-degree adduction. So that 15-degree adduction is called what? Supraspinatus. So those carrying water, maybe you are carrying water, so you just abduct your hand a little, so that is 15-degree abduction. So the next one is infraspinatus. Same thing, it's under the rotator cuff muscle. Infra, so under the spine. Under the spine, it's very wider than the supraspinatus. It's very, very wide. So this one is infraspinous fossa. So the infraspinatus is coming from the infraspinous fossa. Very, very simple. And it's inside also in the greater tubercle, but in this part it is in the medial facet of the greater tubercle, while the supraspinatus is inserting on the superior facet of the greater tubercle. The same nerve, suprascapular nerve, the same nerve, but this one now, its action is lateral rotation. Lateral, as if you want to slap somebody at the back, move your hand, slap somebody, or you are doing the swimming part where you are breaking through the water, moving forward. So that's what we call lateral rotation. You see it on the board now, what we call lateral rotation. Now sit. What is the T? Teres minor. Teres minor. So when you remember teres minor, you remember the rotator cuff muscle. So teres minor is another one. So teres minor is originating from where? The lateral border of the scapula. The lateral border of the word scapula. But this lateral border is the inside part of the lateral border of the scapula, the inward, the medial part, the inside part, or the costal part of the lateral border of the scapula. So where is it inserting to? Greater tubercle, but this one on the inferior facet. So the supraspinatus is the superior facet, the middle facet is for the infraspinatus, while the inferior facet is for the teres minor. But this one is different, it's not like them. It now supplies what? Axillary nerve. So axillary nerve here is C5-C6, but from the what? Posterior cord. Go and watch my video on the brachial plexus. So what is the action of the teres minor? One important thing here, it does lateral rotation. Lateral rotation. Also, it assists in weak abduction. But ultimately its chief is lateral rotation, because it assists the infraspinatus in lateral rotation. Very, very easy. Hope you are getting it. Very nice. Sits. What is the S? The S there is subscapularis. Don't forget, subscapularis. So subscapularis, so but this one is originating from where? The subscapular fossa. I told you that the scapula has the front and the back. The front has a depression called the subscapular fossa. That's where the subscapularis is coming from. It's coming from there, but inserting on the lesser tubercle of the humerus. The lesser tubercle of the humerus. But one thing, that all rotator cuff muscles are always inserting on the greater tubercle, except from the subscapularis that is inserting on the lesser tubercle. Very, very easy. Very nice. So another thing you have to know, what is the nerve supply? It is much more different. I told you that teres minor is different, coming from the axillary nerve, which is from the posterior cord. So go watch my video on brachial plexus. But subscapular is coming from the upper and lower subscapular nerve. Upper and lower subscapular nerve. So upper and lower subscapular nerve is at the posterior cord of the brachial plexus. Don't forget. Posterior cord of the brachial plexus. About C5 to C8. Don't forget C5 to C8. So what is the work? What is the work? Again, I told you that if you are coming from the medial part or the costal part in connection to the ribs or the thoracic cage, what do? You do medial rotation and adduction, just like the what? Pectoralis major. The pectoralis major is coming from the sternum and the costal cartilages. So since it's coming from the sternum and the costal cartilages together with the rib, it's doing medial rotation and adduction, just like the same thing subscapularis is doing. Why? Because subscapular is coming from the costal part of the scapula. Don't forget, it's very, very easy. Now all this action they are doing, they are what? Rotating the what? Shoulder joint. All this action they are doing, they are performing this movement on the shoulder joint. So which means they will adduct, they will do lateral rotation of the arm at the shoulder joint. So what we are doing, we are working on the shoulder joint here. So since you understand sits now, what is down there? What is down there? So what is down? Deltoid. Deltoid is the most important part here. Deltoid. So the deltoid here is just, if you touch your arm, just the lateral part of your arm, just that place you used to do I have power. So that lateral part of your arm, which you are seeing on the screen, so that's your deltoid. So where is the deltoid coming from? So very, very easy. So just like the rest, the deltoid is also important there. It's very, very important. It's an important part there. So the deltoid is originating from three places. The lateral one third part of the clavicle. Lateral one third part of the clavicle is coming from the acromion process. Are you getting me? So it's coming from the acromion process, and lastly, it's also coming from the scapula. So it has three origination. It has three origination. So when you say deltoid, it's just like a triangle, just like a delta sign. So when you call it deltoid, delta, that's where you're coming from. And what is delta sign? A triangular sign. That's why you call it delta. So it has three: anterior, middle, and posterior. So the anterior part is the clavicle, one third. The middle part, which is the triangle there, the middle part is the acromion, while the posterior part is the what? Scapula. Very, very easy. And it's inserting on the deltoid tuberosity. It's inserting on the deltoid tuberosity. And where is the deltoid tuberosity? It's on the what? Surface, on the lateral surface of the humerus. On the lateral surface of the humerus. Now, what is the nerve? The nerve here is the axillary what? Nerve. The nerve here is the axillary nerve. Don't forget the axillary nerve. C5, C6. Don't forget. So sit down there. Now, what is the action? The deltoid has, since it has three origination, which means its action will be three. So remember the anterior fiber coming from the clavicle. If you are coming from the clavicle, what you do, you flex the shoulder joint. You flex the shoulder. So you are flexing the arm at the shoulder joint. So flexion, you see it on the screen how they flex. So you go practice what flexion is. So you flex the arm at the shoulder joint. For the posterior fiber, it extend the arm at the shoulder joint. So posterior fiber of deltoid extend, anterior fiber flex the arm at the shoulder joint. Are you getting me now? So just like you want to carry water from the ground to your head. So as if you want to carry water from the ground to your head. So that is what? Flexion of the shoulder. You get it now? So since we understand flexion, extension is that you are moving your hand back, your shoulder joint back. You get it now? So that is extension. But the acromion fiber here, the acromion fiber, which you call the medial fiber, does what? It does what? Abduction. But this abduction here is 90-degree abduction. So from 0 to 90 degree is called what? Deltoid. 0 to 90 degree abduction is deltoid. But 0 to 15 degree is supraspinatus. Don't forget. Don't forget. Now, moving on is the teres major. The teres major. Teres major also is an important muscle. It's very, very important. So it's very simple to understand this muscle because it also forms the inferior border of the quadrangular space. So I'll also be doing my quadrangular space. We do major spaces and minor spaces here. So it forms the inferior border of the what? Quadrangular space. Are you getting me now? Because it is the gap where the axillary nerve and the posterior circumflex humeral artery passes to reach the posterior scapula. Don't forget. So where is its origin now? Its origin is very simple. It originates from the posterior surface of the inferior angle of the scapula. The posterior surface of the inferior angle of the scapula. Very important. And where is it inserting? It's inserting in the medial lip of the bicipital groove. So don't forget, in the bicipital groove, you have a lateral lip, you have a medial lip, and you have the middle part, which is the groove itself. Are you getting me now? So we call it the bicipital groove. So if you want to remember the insertion, you remember a lady in between the two major. A lady in between the two major. So who is the lady and who is the major people now? The lady is the latissimus dorsi in the middle, while the two major is the pectoralis major and the teres major. So the teres major and pectoralis major is coming from the medial and lateral lip, where the pectoralis major is coming from the lateral lip, while the teres major is coming from the medial lip. While in the middle is the lady, which is the latissimus dorsi. So that's why you remember the insertion of them. Since we say it's coming from the posterior surface of the inferior angle of the scapula and it's inserting on the medial lip of the bicipital groove of the humerus. So what is the nerve supply? The nerve supply here is the lower subscapular nerve. Don't forget the lower subscapular nerve. So remember, for the subscapularis is having both the lower and the upper subscapular nerve, while this one is only having the lower subscapular nerve, which is what C5, C6. So remember, in this one is different also because it is related to the medial part of the back. So the spine, the vertebrate, it is close to the vertebrae because it's in the inferior angle. So it does the same thing that everybody is doing: adduction and medial rotation. So it does adduction and the medial rotation just like the subscapularis. So subscapularis is the same thing: abduction and medial rotation. The P major too, abduction and medial rotation. It's just that the P major adds flexion there because of its origin from the what clavicle, but this one there's no flexion. It also does extension too, just like the what latissimus dorsi, and again it's coming from the back. Very, very easy. So I hope it all made sense. So we are talking about sit down there, sit down there. So the sits muscle are the rotator cuff muscles. So when you remember the rotator cuff muscle, you remember the sits muscle. You get it now? So now we'll be talking about what are the some clinical notes we have to note here. So for the clinical notes, you always remember what we call rotator cuff tendinitis. So what is the rotator cuff tendinitis? You remember that there can be an inflammation of the tendons of the rotator cuff muscles. So there can be an inflammation of those. Now this usually what occurs secondary to what repetitive use of the joint. So when you use your joint often, you can have what rotator cuff or tendonitis. And the muscles mostly affected here is the supraspinatus. So when there's a supraspinatus damage, what happens? You will not be able to what abduct, 15-degree abduction. So don't forget rotator cuff tendonitis. Tendonitis, itis means what? Inflammation. So when you remember itis, you know it is inflammation. And the muscles that is specific here is supraspinatus, which means during abduction it will rub against the what coracoacromial arc, and over time this will cause what inflammation, degradation, changes in the what tendon. So how can you treat this? You need what physiotherapy. So with physiotherapy management, you can what manage the movement around that what joint, and also you immobilize for a time. Also you can get the physiotherapy management under my physiotherapy playlist, so go watch about the management of the what rotator cuff tendonitis. Also the deltoid can be injured when there's a damage to the what axillary nerve. So you can, when you have the damage to the axillary nerve during a surgical neck fracture of the humerus, you can also damage the what deltoid. Also winging of the scapula is also there. So all these are small clinical notes you should also take. So I hope it all made sense to you and you understand everything I've talked about the intrinsic muscle. So you remember sit down there. So remember sit down there. You remember the intrinsic muscles around the shoulder what region. So we discussed the what muscles of the pectoral region in my first video. Then now we are discussing the muscles, especially the intrinsic muscles around the what shoulder region. So I discussed that what they help is that, and they help in rotation of the what shoulder joints, and since they help in rotation, also stabilization of the joint and help to rotate it around all range of what motion. Very, very easy. So if you are just joining me, make sure to like, subscribe, share, and also share to all medical students. And every time when you are reading, use your what atlas, use your atlas. So I'll be seeing you in the next video, which is extrinsic muscles around the shoulder region. Bye bye.